Welcome, everybody, to this episode of Doctor-Patient Conversations on an important and a very common but much neglected topic of infections. Confusing between infections, infectious, contagious, all these questions come to our mind, and we continue to get affected without realizing the harm that we are causing ourselves. And our questions are never answered. So here we bring to you Dr. Malti M, MD, who is an expert in microbiology, in infection control, and her passion is creating quality among many, many people. She is a valued member of CAHO and at present a consultant in infection control at Meenakshi Super Specialty Hospital, Madurai. Welcome, Dr. Malti. Thank you for joining us and listening to our questions and patiently answering them. Over to you.
Thank you. Thank you, everyone. And thank you, Nadira ma'am and Patient Safety Foundation for having me here. It's a very, very good initiative, I must say. We talk more about all these diseases and infections to our healthcare workers, but most of the time we talk about it to patients. So thank you for having me here. We are good to.
I forgot to introduce myself as usual. So I represent patients from the Patient Safety Foundation. My name is Nadira Chaturvedi, and I'm here just to pose questions collectively on behalf of all of us. So my very first question, ma'am, is the confusion between, we use these terms loosely. I got an infection, a stomach infection because I ate out, or I went traveling, so I got a urinary infection, or infectious diseases. Suddenly we think of COVID or dengue. And contagious, we certainly think of coughing. What is the distinction between these three words and how does it begin?
Okay. So yes, of course, we use this word just like that, how we use the day-to-day words like brushing, eating, all those things by using the mouth. So, but there is a clear-cut demarcation in these terminologies when it comes to the scientific medical terminology. So what is infection? Infection is something, a living organism that we say bacteria, virus, fungi, and parasite. These living organisms enter into your body and cause something called infection. So the infection, if it affects a particular portion of your body, let's say nose or respiratory tract, it will present as a running nose or cold. That is the symptom that you get because of that infection. So when this affects your lungs and become a pneumonia, then it becomes an infectious disease. So what we are saying is infection. What you are saying to us is actually a symptom. And once it affects an organ, we use the word infectious disease.
Ah, that's a wonderful distinction. But as people, as commoners, we call everything infection, right? Even if it's a wound, it's a burn in the kitchen, or just any boil on my skin. So what are the organs typically where infection can surface? Or as a patient, I understand or identify what you call a symptom and what I call an infection. Which are the various areas of the body?
So infection can affect every area or every part of your body. We can't say that one particular area is like blessed by the nature or the God that you will be protected forever from infection. That's a problem with infections. The bacteria, viruses, and funguses are very, very clever than the humankind that they can, once they enter through a niche or just a break in the skin, it can even affect your brain. It can kill you. So it can, one line, it can affect any organ of your body. It depends upon which infection you're getting. For example, the most common infection in the rainy season is dengue. Dengue will affect the blood cells. So that's why you're having bleeding and other disorders. If it is malaria, it can cause brain fever. It can affect your brain. So every infection has some attraction to a particular organ and it can go and affect the organ. But any organ can be affected by almost all the infections.
Yes, ma'am, commonly when we talk about infections, we talk about a wound, an opening in the skin, or maybe a ear infection, which gives me a headache, or even maybe a dental, something like that. So are you saying that any organ like a liver or a lungs or stomach or all that is basically because of some external pathogen or external reason when we face symptoms?
Yeah. So we have a very good protection system in our human body. You all know that our skin is a very good barrier of infection. Once you get a cut in the blade when you're chopping off vegetables, your kids are playing in the ground and falling off and they're having the break in the skin. So this skin, which is a good immune barrier, is lost. So the bacteria in the soil, the bacteria in your knife or the vegetable outer layer, there will be bacteria. So all these things will now enter into the breach in the skin, will go inside and cause the sepsis. So that is the pus discharge you will get from the nail, you will get from when you're cutting the lemon, and after sometimes you'll get the pus discharge from the nails. Kids will get a lot of toe infections when they are playing in the mud or all those things. So this is mainly through the break. Some worms, parasitic infections, can even enter without any break. They can penetrate your legs. That's why kids get a lot of worm infections going barefoot in the areas, and then they go in the mud, soil, sewage. They play cricket. The ball will go into the some sewage canal. They'll keep their hands inside. So that's why that can happen through any route. So it could be through your open natural openings like nostrils, mouth, ear canals, and also it can be the breakage either officially by a surgery or something like happening due to a medical procedure, or naturally due to through the natural orifices.
So what I'm trying to understand is that means any cut, any opening, any orifice of the body can be an entry channel for infections. That's right. So it could be maybe anything to our nose. That means it can come by air or by talking or by, because we commonly say food, water, air. So, and you distinguish that there are types of infection or types of pathogens that are affecting it. What are these various types and where do they enter from? You said they have a favorite place. So what are these places so that we can watch out?
Yeah. So we always say there are four more common, especially we are in India. One is bacterial infection. So in India, the most common bacteria that we all face in trouble for years and years, and we couldn't eradicate so far, is tuberculosis. So especially overcrowded slum areas, is narrow spaces, the overcrowded buses, where there is a ventilation less, the cinema theaters, the malls, everywhere. When even one TB patient cough and you're all nearby, or you're in the lift, some 10 people in the lift, one TB patient cough, you all get it because it is an airborne infection. So TB is a bacterial infection which is coming through the air, and it will enter into your nose and goes to the lungs and affect the lungs. There is another bacterial infection. Recently, you all read about shawarma. Eating shawarma, you get diarrheal infection, Shigella infection. Food poisoning is another problem. So this is mainly because of the we can't control our gut and taste. So, but the bacteria also loves to enter. It is finding actually ways. How can I affect these people? How can I kill these people? So it's just going and sticking. So if there is a very bad way of storing the food items, long-standing, the refrigerator cleaning issues, the cold storage is not maintained, so the bacteria will start multiplying and cause food poison. These are the two most common in India. Viral infections, we all have learned about how virus is a deadly one in COVID-19 pandemic. Still, people having panic now, still like whether COVID is going to come back or not. Then dengue and influenza, that is the flu seasons, we all get the rhinorrhea, the nasal secretions, all these things are viral infections. Fungal infections is mainly limited to children's and immunosuppressed. When I say immunosuppressed, it's cancer population, diabetic population. You will see a lot of white patches in the cheeks and white patches in the buttocks, skin lesions. So most these three, and last is parasitic infections, which is the most common in Indian women, that we all have anemia. What is the reason for anemia? Because there is a bug inside your bowel. Whatever you're eating, this bug is actually sucking your blood. So whatever you're eating, it is going to suck your blood. You're getting anemia because of the worm infections. These were the common infections in India.
Right. I now recall, because there was always a deworming exercise when we were children and we hated it, but perhaps that's why it was to protect us. So, to summarize, that means you have bacterial, you have viral, you mentioned something called fungal, which is, we normally take it as allergy or skin itching or redness, etc., and a parasitical. And I always thought parasites were big worms, but parasites can be anything else as well, I'm supposed. So how do they travel from one person to the other? How does it get propagated? How do I contact it? And how do I protect somebody who has it? What would be the methods?
Okay, so that is called route of transmission. So how this infection is going to get transmitted? So there is two major ways I can say. One is directly from human to human, and there is an indirect way. Indirect way is huge. Example is dengue, malaria, yellow fever. All these things is going to get infected because of a small bug which is annoying, ringing all the time. That is your mosquitoes. So these mosquitoes can be a big trouble person whenever it's the seasonal malarial season. Then, as I already mentioned, the foodborne pathogens, that is a typhoid fever, Shigella, your diarrheal pathogen, cholera, all these things going to be sticking in your food and contaminated with the water and going to cause infection. Some infection will spread from human to human, which is very worrying. That is the flu, COVID-19, tuberculosis, mumps, measles, chickenpox. One gets, then the whole school children will be affected, whole family will be affected. So infection, something directly human to human, and through some vector, we say vectors. So that is the way it gets transmitted.
That means we have to be careful, particularly in school-going children or crowded places or markets or even while traveling. Touch surfaces, touching people, water, food, and of course, not going near someone who's sneezing, I suppose. That's what it is. And how do you know as a doctor how to treat it? Like we just take something and we assume that it go away, take water, take hot water, take drink, go to sleep. So is there any method that, what the diagnostic methods, are there specific ones and therefore the treatment will be different, or is it common to all?
No, the treatment is entirely different. I think that's why I said that this is very, very important for the public to know. So I would want to concentrate more about flu. So whenever the season of flu comes, people get rhinorrhea, cold, cough, sore throat. The first thing, as you said, they'll take some water or some soups, and then it don't get settled. Then third day they will look back the previous prescription the doctor gave that when they have cold, or they go to the nearby pharmacy and ask that I have cold, and they take some pills. That pills are the killer one. They are called antibiotics. We don't want anyone taking antibiotic for a viral flu infection, because bacteria.
We love them. We just love antibiotics nowadays.
I don't know. It's like everyone's.
It's wrong. I know it's wrong. Even then.
It's like energy boosters, because the colors are also like different colors are coming. They love to take it. I don't know. Especially after COVID, this azithromycin has become like everyone's savior now. Even on the first day and second day, they are taking it. So the key message I want to convey to everyone who is listening to the podcast is antibiotics will kill only the bacteria. It is not going to kill the virus. So your flu is caused by the viruses. So for viruses, even if you take antibiotic or not, it will settle on its own on 5th day or 7th day. So since because you took the pill, it doesn't mean you settled. Even if you don't take the pill, you will be fine in the 5th day or 7th day. So that's the management. It's self-management for most of the flu. For bacterial infections, we have specific investigations. So just by WBC count, we will be able to know whether it is bacterial or viral. Of course, fever will be there. We will be basically running certain counts in the body, neutrophil count and other tests, liver function test also for some bacteria. For bacteria, we have specific drug. So we have to treat. For malaria, we have a specific antimalarial drug. So typhoid fever, a specific drug. For parasitic, we have specific albendazole and other drugs are there. So for each infection, there are specific targeted therapy. So we need to know what infection you have gone through. We can't just have one for all.
So this habit that we have formed of just popping a pill from the chemist who becomes our godfather doctor is really wrong, and then it's dangerous. But how do you diagnose which one needs which one? Are there any specific diagnostic tests as well?
Yes. So since the most common symptom that the people will say is fever. So whenever people comes with fever, the next point that we all will ask is, where is the fever coming from? Is it because of the respiratory infection? So when they say there is a lot of sputum comes up, then we will ask them to cough out the sputum and send it for bacterial growth testing and viral PCR testing. So we take the swab from throat, we take the swab from the nasopharynx, we send it for COVID testing to rule out all these infections. If it is a urinary problem, let's say a female who has gone for a trip and then come back and say my urine is burning all the time, we catch hold the urine and we send it for the bacterial culture and we see what bacteria has infected the urine. And dengue and other tests, we can just take blood samples and we can do a test called serology, which will find out which viral infection, dengue, scrub. There are a lot of, I don't want to name anything and confuse people. So generally it will be blood investigation, urine investigation, sputum means sputum investigation, chest, we can even tap the fluid and send it. In addition, some imaging. If it is a brain infection, we will do CT, MRI scan and we will find it.
Right. That means when the doctor tells us to do a blood test or a throat swab, so there is a specific purpose behind that, or a urine test, I mean, in the routine, right? I mean, they normally take us. That I understand. You mentioned that sometimes people are, you mentioned the word immunosuppressed or immunocompromised. Who and which kind of people are particularly prone or at high risk of getting infections? Which are these people?
So normally when a child is born from the mother, okay, so that's the time the immune cell starts developing. So till 2 years of age, the body will not have enough immune cells to fight with the infection. So up to 2 years of age, the baby is having less immunity. We should be very cautious. And then after that, once the child grows, it's good. Then once they become an adult, after that, all the infections or diseases starts coming now. So when they become a diabetic, when they become a cancer patient or diagnosed with a carcinoma and on chemotherapy drugs, when they have any nephrology related issues and on dialysis, when they have any comorbidities, taking steroids drugs or any immunosuppressive drugs, there are a lot of drugs for rheumatoid fever, rheumatic immunology problems. They will be put upon immunosuppressive drugs. All these population comes under the group immunosuppressors, where they should be very, very careful when compared to a normal immunocompetent person.
Is that the reason why they tell cancer people not to, touch people or go in crowded places, or even people with chronic kidney disease? That's the reason. And babies have to be protected.
Yes.
What about older people? Are they with age? Does it go down, or is it just because somebody had an operation or a surgery, or is it just generally age related?
No, generally age related, because the bone marrow is the one which produces these immune cells. So once you are aged, your production of the new cells comes down because you are going into the phase of senile. So your production of cells comes down. So after 60 years of age also is very important that people now says that vaccine should be taken again, because their body's immunity is coming down.
Right. So older people, post-surgical people, and as you said, anything with other illnesses, when you call comorbidities, that means other illnesses, etc. Now, if I have a member in my family, how do I protect myself? What are the practices? We'll come to vaccines, but I want to know if there's any practice that we should do, what we can teach our students, our children, our colleagues, the safe practices by which we can protect ourselves, or rather prevent anything like that. What would you recommend? Yes.
I think I will take the keyword from you, ma'am. The prevention is better than cure. We all know that the cost of antibiotics, the cost of investigations is all high, but the people take it for granted. Now, COVID-19 is coming up and there is a news going on, but still, even in the hospital sector, when we say wear a mask,
right,
there is a lot of like, why is she saying to wear a mask now? It's not a deadly disease now. We have been vaccinated. Who knows what strain it's so best thing is prevention. Those days, I think you all remember when our granny was there, when I used to play in the mud and come, she says, don't enter, go wash your hands and wash your legs and come. Now we have a lot of disinfectant solution being available in the supermarket. We have everything in the house, but
we don't use it. We still don't use it. There's a fatigue.
Yes. So it's all start from the house. So start teaching your children that nail cutting, the big one, because the eggs will be sitting in the nail. When they eat, the eggs is going to catch and become a worm and suck the blood. So small things, personal hygiene is important. When they have the habit of washing their hands, cutting their nails, grooming themselves, and learning the personal hygiene habits, wherever they go, they'll be able to follow these practices. Second is when you go to the hospital sector, or you have a infected people, or you have a person on diabetic wound infection, you're giving care to the person at home. You have that population in your house. I would suggest talk to your healthcare provider, go for a training even for a day. We are here to tell you what you have to do and get learned about how to do hand washing. Whatever we teach my nurses, I think that the same session should go to the healthcare providers and the caregivers also. They should know how to wash their hands. They should know how to do a basic dressing. They should know how to give a right tube feeding, how to wear a gloves. So this is the advice I wanted to give to hospital sector and also to the caregivers.
Right. So the basic practices in our earlier days, I know I come from a smaller town, we had to leave our footwear outside, and the home footwear was always different. And then it became a custom, as if it's a religious custom. It's actually a scientific custom. Or cutting your nails, as you said, or washing your hair or your hands. I think nowadays, it's the car keys or the door keys or the doorknobs or even the phones. We never watch these. But we must have touched so many things because of that. So it begins from the skin, it begins from the hand. And although during Corona, we did a lot of hand wash, I remember all those steps, and then I wiped them with my sari or with my duster, which was already dirty. So I used to laugh about it.
The problem is these mobile phones have been taken inside the toilets also. People sitting in the Western toilet watching mobile phones, they don't wash and then they come back. So that's a problem. Mobile phone are the biggest carriers of bugs.
So tracing our day-to-day items, including spectacles, I suppose, right? So these small things which are neglected, washing them, changing your toothbrush probably once a month, or washing your comb would be probably the base things. But on a broader scale, are there any preventive measures in terms of vaccinations that we should all ensure as children or as teenagers or as adults?
So this vaccine is a game changer in the evolution of this bugs. So this has become the what to say, the armor of all the infectious specialists, that once we vaccinate, we get the confidence. Sometimes 100% confidence in certain infections. Like COVID, we can't say 100%, but we still can tell the people that you are protected from death because you will not get a severe disease. So yes, of course, vaccinations are the mantra and game changer in this world war that we go through with the man and the microbes.
Right.
So we all know that there is something called pulse polio immunization. You all know that yearly twice we take our kids and they put a drop of polio drops. And we would have all seen a lot of polio cases
Right.
3 decades back. Now we can't see anyone with polio.
No, that's true. That's true.
Yeah,
Yeah.
so that's one good lesson we all learn. So I think every child born in India now goes through the immunization program in both public sector and private sector. Most of the problems comes with the hilly region and remotely inaccessible areas. They couldn't come and continue this vaccination.
Okay, reaching them. Right.
Yeah, but the list of vaccines everyone should know. The most common is we have is DPT. D is diphtheria. P is pertussis. T is tetanus. These three were the killer. Maybe now the younger generation will not even know. Even my juniors now, they don't even have seen a case of diphtheria, tetanus, and pertussis. But these were the killer diseases.
They were common earlier. Yes.
Then polio, yes, of course, it's very important. You have to continue it. Measles, it was also earlier very common. It is coming back again in United States because a lot of dropouts were there in COVID time. People didn't take the vaccine, so you have to take it. Mumps, which comes as a swelling here. Yes. Also, especially for the guys, boys, it can cause orchitis and can cause infertility. So you have to take the vaccine. Rubella, very, very important for women. There is a female, because it can cause congenital rubella syndrome and affect the babies. Then hepatitis B is a very, very, very important vaccine because it is causing a lot of hepatitis across the country and the world. Then the pneumonia is caused by few bacteria called pneumococcal and Haemophilus. So these vaccines are already being put up in the Indian government schedule. So it's important that we have to take everything as per the schedule given by the government.
So when you mentioned tetanus, I mean, the illnesses that you mentioned, that means jaundice. When you say hepatitis, our common name would be jaundice, right?
Yes,
jaundice.
And
influenza would be just flu. Yes. And mumps or whooping cough and those kind of things. No one does see this. But tetanus, I know that, do we have to take it again and again, any of these vaccines? Is there a booster or is there a validity for them, 5 years, 10 years, or it's once taken, it's rest of the life?
Yes. No, for tetanus, it's 10 years because once some dog bite occurs or once if there is a wound or a cut wound, immediately they'll give TT, that we all remember. Right. Cut wound, go and take TT vaccine. So, but if you have taken in the last 10 years, you don't need it. If you have not taken it, then you have to have a booster vaccine.
And I heard some new ones, something called shingles or some fine actors are advertising those things. So that's why I noticed them. Yes, shingles, and even for young girls, HPV vaccine. I think are these also preventive in nature, and they should take it.
The women should take it. It's very important that the human papillomavirus vaccine. It will cause cervical cancer, so you have to take the vaccine. If girls then from 9 to 12 or up to even 18 years they're giving now. So go to a gynecologist and take the shots. Very, very important. For it is basically chickenpox will come in the early age.
Right.
The later period, it will cause herpes zoster. There will be a lot of lesions in the body, which is very, very, very painful, excruciating pain. It will come especially for the immunosuppressed population, cancer population, HIV and other people.
I see.
So better to take Shingrix vaccine earlier.
So that is especially for those people who are compromised.
Yes.
So some people are hesitant. They said you're injecting more worms in me or more dangers in me. This is what you probably call it hesitancy or something. How do you overcome? And if I ignore your wise advice, where would I land up in terms of diseases? What would be the trajectory of the disease or the infection? Would it get worse or will it disappear by itself? That's the faith we have.
Okay, so we always call it's called vaccination myths. People are always there to create myths and disbeliefs on vaccines. But I hope the world have seen in the last 5 years during the COVID-19 pandemic how vaccine has stopped the COVID-19 pandemic. I can say it's not 100% stopped it, but you can see a lot of deaths have been prevented because of the vaccination.
Right.
And if you are in the 1970s, you know about polio. How many polio cases have you seen
Yes,
now as much as
absolutely.
you have seen in the past?
Right.
So people talk bad and good about anything that is coming on the market. If you have seen your evidence on your eyes, then you have to believe and always believe your healthcare practitioner's advice.
That's a strong one. That's a strong ending, but it's great. Any three tips? You've given some great advice on not mixing up infections, the variety, and each treatment for each kind is different. That's a great one. Also, you listed out some vaccines. Any tips for the general public? You mentioned healthcare workers, but what about families, caregivers? Because we bring it into the hospitals, and including the hospital acquired infections. How do we protect ourselves or the nurses, or other than the patient also? Any three tips that you would like to summarize?
Yeah, so most of the time the infections for the patient, especially let's say an oncology patient, we worry about the caregiver who is there. The mother should not give it to the child. So the mother also should know the hygiene practices. So most important, again, I may be reiterating that is hand hygiene. You're going to feed your baby. If you're not washing your hands after your toilet, then you will be passing on the infection. So then again, neonates, if you're going to do a breastfeeding, you're going to pump the milk and give it for the baby and rush to your IT work, then you have to wash your hands before you're pumping the milk. All these things are simple because this is going to touch your baby. This is going to touch your elderly parents. This is going to touch. So clean it properly, hand hygiene. If you have any sickness, please avoid. If you remember the old days, sickness, you will be put up a small room. You will be given
Yes,
separate plate.
isolate.
Typhoid fever, I still remember when I got in +1, then they gave a separate plate, separate mat, everything, and they locked me in the room. Now it may feel like why they're doing it, but those days, because they don't have such vigorous treatment, they stopped it being transmitted to my siblings. So isolate yourself at least in the initial stage of high infectious period. Then very important is wash, that is water, sanitation, and hygiene. The drinking water should be safe. Your place should be very sanitation friendly and safe. And hygiene is very important.
That was a great advice. That means anything that is coming up with your hands, to sum up. So it begins with the hands because we touch everything: our faces, our items, our food, our water, people also. So it begins with that. Anything that has a cut or an opening, a wound, a cut, a burn, and of course, isolate yourself in the initial stages if you think you can transmit it orally. So they sound basic, but they can prevent. A stitch in time saves nine, and lots of lives could be saved if you followed this simple advice. Thank you. Thank you so much, Dr. Malti. And we will come back to you for more questions later from our viewers. Thank you for helping us in this important topic.
Thank you. Thank you, Nadra ma'am, and the entire Patient for Patient Safety Foundation, and Som sir also for having me here. Thank you once again.
Thank you.
These doctor-patient conversations are brought to you by CAHO and Patients for Patient Safety Foundation. CAHO is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by CAHO, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors, clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.